My name is Dr. Simon Moshara Kigondu. I am the president of the Kenya Medical Association. Kenya Medical Association is the professional association for all doctors whose twin mission is advocating for the welfare of its members and advocating for the highest quality of healthcare in the country. Working with CEBA has had a great impact on the Kenya Medical Association. The evidence-based advocacy has added methodology to the way Kenya Medical Association advocates over and above the normal advocacy as a result of reacting to issues. CEBA has helped us use evidence-based as a policy advocating tool. What does that mean? It means that we now, as Kenya Medical Advocacy, are not only waiting for the issues, especially of RAMCA and other issues to appear. We are actually using evidence to provide policy guidelines to both ministries and the country without being reactive. So we have added another tool of advocacy as a result of interaction with CEBA. We have learned that you can actually go to the policymakers with what the problems are, with your proposed solutions, and the policy people actually listen. And that way, we have also learned that you can actually prevent problems that are as a result of a lack of policy from happening by being advocates with solutions instead of just being reactionary to bad policies. The CEBA project has, as I alluded to before, has actually shown us that when policy leaders are engaged directly, they can actually advocate for good policy changes that affect the populace. The second lesson that I have learned is advocating to the community directly leads to us collecting more local, more evidence-based data that can actually be used to change policy or influence policy at local levels. That eventually can be scaled at a national level, but first data is collected locally, utilized locally for local policy changes, and the local governments, especially county governments, can actually use this information and the community to make better health policies, especially for RAMCA. Thirdly, we have learned that when you get our local champions, advocates who are members of our associations, who have been very useful to actually take up the roles of identifying problems, identifying policy solutions, and engaging locally, the people listen to them more. Previously, advocacy tended to come from national, going downwards, and people tend to listen to the people they know. And therefore, when you engage our members who are in the local areas, we have noticed that the people listen to them a bit more, and the things we've always wanted to do move faster than when you have a foreigner coming to dictate to the locals what to do. Many a time, the Kenya Medical Association has reacted to issues, but we have found that we do not have adequate data to support some of the positions that we feel strongly about. With CEBA and the slow creation over the 3 to 4 years of having actually policy briefs, Kenya Medical Association has actually used the policy briefs developed by CEBA to convince policymakers about decisions that they need to make as policymakers. It is difficult to convince policymakers without data, but we have seen how policymakers react to data. For instance, if you tell a county that their maternal mortality is high, it's one thing just to tell them that and they will say it's propaganda. It's another thing to actually generate data locally and provide it to the leaders. And it is on this that a lot of changes have been made to the way the policy makers are reviewing both CEBA and Kenya Medical Association. Collaboration with other players really helps give credibility to the advocacy message. Many a time, policymakers tend to divide health professionals along cadre lines, along regional lines, and the advocacy is not strong. And because of collaborating with other associations like the National Nurses Association of Kenya, Clinical Officers Association, the Nutrition Association, and Kenya Obstetric Gynae Society, Kenya Pediatrics Association, the message that comes out from a joint forum like that has more credibility because it does not allow people to divide you along cadre lines, along association lines, along regional blocks. And therefore, we have noted that working together tends to increase credibility and the people listen more. In fact, it is during the CEBA project that the county governments reported that for once there seems to be one body that is coming and looks like is representing everyone, different from what they normally had, where you would have the doctors coming in, they bring their issues, the nurses come in, they bring their issues, and the others. And therefore, working together with all other associations has been very useful in getting the policymakers to listen to the table, and also it has helped our commanderate. We are working together. There has traditionally been a lot of cadre wars, so to speak. So when you work together, you get to trust each other, and we take the policy lessons a bit further in this country. HPV vaccination and HPV itself has been for a long time a topic that tends to generate a lot of controversy. And the Kenya Medical Association, being a medical association, has professionals who are able to speak to the science of HPV. As a result of that, Kenya Medical Association has participated in many forums that have educated the public, and when the public sees a doctor talk about HPV, they are more likely to listen to them because they are talking as professionals. Kenya Medical Association in the HPV campaign has also participated in media programs where HPV vaccination is being promoted. It is important that the population sees those who actually work in the field of medicine, for instance, instead of the messaging of HPV being driven politically. A lot of people dismiss any message that looks like it's being driven politically, and because of this, the participation of Kenya Medical Association is bringing credibility, and we have actually seen that a lot of people, and we as doctors are actually called, and we talk to a lot of our patients who now have come to understand the importance of HPV vaccination and the primary prevention agenda. CEBA has fundamentally added a secret weapon, so to speak, to the advocacy that KMA is about. Using policy briefs and generating local data is an important addition that CEBA project has added to Kenya Medical Association. Going forward, we intend to have more collection of data and providing evidence base Two, going forward, we intend to engage at the local level with the communities, because that is where the impact is most. And in terms of HPV vaccination, we intend to continue our advocacy through our various fora. Kenya Medical Association has a very strong continuous medical education forum. It has a very strong presence on social media, and we also continue with these lessons in our various meetings, which include the annual general conference and the various council sessions and the various meetings with the local divisions. And we thus appreciate CEBA for actually making what we had previously done as an association on a small scale to a bigger and better, impactful way of ensuring that what is needed in health is done. We encourage more policymakers to use evidence and the policy briefs that have been generated by the various professional associations to actually guide policy. We have actually seen an improvement in that, and therefore when evidence-based advocacy is used, it actually brings an impact in the health of Kenyans.